I was actually getting my affairs in order because I didn't know what was happening. Didn't know what it was, but I ended up in the hospital numerous times in emergency, terrible chest pains, back pains, almost passing out. They kept telling me everything was fine, so you just kept going home, but it was when my feet went completely numb, and then that's when I discovered the Mercury thing.
He gave me a phone call describing some of the symptoms that he was having.
So I told him 2 of the symptoms I had, and he just kind of named off all the rest. And then he said, we got to get the fillings out.
Mercury toxicity. It's much more widespread than I think people think because of the widespread use of mercury fillings. He immediately booked appointments. We took out his mercury filling safely. He wrote a really nice letter to us saying how we, saved his life. So,
yeah. Without him, probably wouldn't be here.
If you introduce things into the mouth that are foreign to the body, that are toxic to the body, then the nerves in the jaw communicate with the nerves in the brain. There's no relay point there. If you cut your finger, there's relay points between your finger and the brain. Between the mouth and the brain, there's no relay points. It's going straight there. It affects the whole body, or can affect the whole body.
Mercury in dental fillings represents the greatest source of mercury, more than fish and other food and water combined, according to the World Health Organization. Sweden has banned amalgams because of the toxicity they represent to people who have mercury fillings, to dental workers, and the environment. Yet it continues to be widely used across North America.
If we bring mercury into our dental office, there's only 2 ways we can get it out of here. We get a licensed hazardous waste carrier to take it away, or we can put it in somebody's mouth.
When you're removing amalgam, there's 2 things you have to worry about. The first thing is the mercury vapor that comes right off of the filling material as you're drilling. But the other thing that's even more important is the sawdust or the bits that come off as you drill away. Coming from the roof, we've got a high velocity auxiliary suction that will suck out the fumes. The key is barriers and looking after the actual air as the amalgam's being removed. How's your teeth?
My teeth are good.
Okay.
My health was just deteriorating. I couldn't go much further in my treatment without the next step, which is having my amalgams removed, for the simple fact nothing else was working anymore.
Oh, that looks gorgeous. We started removing her mercury fillings quadrant at a time, so there's 4 quadrants.
I had many symptoms. It actually ended up going neurological, where I drove the same way to work for 12 years, and all of a sudden I couldn't remember how to drive, like how to get there anymore.
What we noticed with her is, and she reported this, that every time we removed a batch of fillings, she started feeling better and better.
These are the first dental appointments I've actually ever enjoyed. I had like immense relief. I started crying. They didn't even have it out yet. Sorry. Because I was in such pain for so long that I hadn't felt relief in years. And just by removing that one amalgam, I had a lessening of the pain in the side of my face, my ear, my throat, my jaw. It was instant. So that's why the tears, that's why I get emotional. It's been a huge relief for me.
Are mercury fillings poisoning you? If you are experiencing headaches, chronic pain, fatigue, memory lapses, or other troubling symptoms, learn more at the International Academy of Oral Medicine and Toxicology, www.iaomt.org.